you think back, and if you're watching like another drama show, you know, like exactly, oh
Yeah.
yeah, that was episode 2 or 3. With this, everything mashes together, and that's how actual emergency medicine is when you're on a shift,
Yeah, like
or at least it is for me.
no, 100%.
Yeah.
Because like even the latest episode, where they're like about to, I think the pediatrician came down to the ER, and we're like, wait, dang, that baby's still not admitted yet. Like,
Yeah.
you know, you're like, oh, you've been sitting here for like hours. Where's Peds? Get this baby out of here.
Facts.
Awesome. Should we jump into the
Oh, if it's
clips?
up- yeah,
Awesome.
let's
I think we got yours pulled up first.
Okay.
So you're having a headache and abdominal pain?
Yeah, that's right.
Okay, and which would you say is worse?
My headache was terrible last week, but now,
Hey, you're breaking up. Can you run that back again?
sure. My headache was terrible last week, but now my abdominal pain. Oh,
God, come on, you piece of shit. Fuck. I'll be right back. Sorry. Dr. Alhash.
So tell us what stood out to you in that clip and made you choose it.
I saw this clip and I thought it was kind of interesting because I think, despite I think Santos's best intentions, I think you find yourself sometimes, you know, wanting to kind of just get through the interaction sometimes with patients, especially if you're busy. And I think sometimes we can do harm if we're not like taking our time to make sure patients are able to communicate what's going on. You know, I've seen it happen sometimes. You know, for instance, we're in Houston. We have a lot of, you know, some Spanish folks here, and a lot of us speak some Spanish because we've been in the ERs for so long. But like, you know, sometimes you can miss things if you're not taking the time to, you know, break through that language barrier. And her trying to rush it and it's like, well, I'm just gonna pan scan you, and you know, you could either miss things, you can cause harm. CTs aren't benign. People can have allergies. Maybe she's never had contrast. You know, those are kind of things you have to take into account. And when you're trying to rush the encounter, I felt she was kind of being a little dismissive, you know, and I don't know. I just thought that was something that like I've even had to, you know, tell myself, hey, just get the translator and make sure you understand what's happening before, and give the patient that right. If you drop me off in a hotel in Italy, in a hospital in Italy,
Yeah.
I don't speak Italian. I couldn't imagine trying to communicate that I'm abdominal pain, and no one wants to talk to me in English, you know. So
Yeah.
I don't know.
Yeah, I agree, man. What you're saying too, but even from Santos' point of view, like the equipment's not working. What do you do? I looked at that too because I mean, she said she had abdominal pain. Her ordering a CAT scan. There's some financial implications to that too. CAT scans aren't free. They cost a lot of money in the ER. And also too, I'm looking at it from Santos' point of view. You got a patient sitting here. From clinical standpoint, the headache's been for a week. Probably wouldn't be concerned about the headache, but the abdominal pain, you have someone sitting there for 2-3 hours waiting for an interpreter. I can understand why you want to get a CAT scan. If you're sitting there with like a appendicitis rupture, like a small biopsy, something like that crazy, you know, we kind of already know if she's a tender on exam, you might get a CAT scan. So I can understand why her ordering the imaging to try to get something going though. But it's a frustrating situation. And also too, you have her writing stuff down. She got a headache. She probably don't want to be reading stuff, writing stuff down. So it's already frustrating for the patient. It's a difficult situation that happens, man. The internet's probably bad. She can't get someone to translate. So I understand where Santos coming from, you know, from why she ordered it, but you know, like you said, the CAT scans are benign. You know, it's going to cost the patient a lot of money as well to get that CAT scan. That may not even be necessary if you get the translator and talk to her about what's going on actually.
Yeah, 100%. I think I agree with both of you all. Like so many times we're like really, really busy, and the easy thing to do is like, oh, I think I know what's going on. Let me just order these tests, and then we'll circle back and figure it out. And that's the wrong thing, right? Like every person that comes into the ER should be treated equally. And you know, if they need sign language, if they need another language, a lot of times what will happen is like here they show you know, the device not working, internet connection. That happens frequently, but a lot of times, once again in Houston, there's lots of rare languages from Asian countries, African countries, where you click on that language and the wait time, 20 minutes. minutes and no one's on the other side because no one's on call, or it's that person, the one person they have on call is probably sleeping. And so this happens way more than, you know, the average person may think, and usually with languages, but sign language as well. So yeah, it's frustrating. But on the flip side, I remember in residency, I did residency in San Antonio, obviously a huge Spanish speaking population. They would have like 5 or 6 human interpreters there.
Oh, nice.
And that is day and night difference between like using an iPad, because so much gets lost. And I think that how the iPad folks are trained, they literally just translate stuff, and they won't say, like, if I'm asking them, like, how long's the abdominal pain been going on for, and the patient may start talking about like their runny nose, they'll just translate that, and they won't be like, oh no, but he asked you about the abdominal pain. That, I guess, is their protocol. But like, I remember with the humans, it would be like, okay, we're gonna get to that, but let's focus on this, and they'd be able to redirect and almost be like a second provider in the room.
Nice.
And so I say all of that to, I think we need to invest in those resources rather than like cut funding and be like, oh, you know, iPads are less expensive than a human and cheaper, and let's you know, focus on that, because there is a huge difference between a human and an iPad
100%.
in the room.